Hello, and welcome to the inaugural episode of the Access to Wellness podcast presented by Access to Holistic and Productive Living. I'm Ralph Williams, the C-suite officer of the organization. Today we have a special episode dedicated to two vital topics: mental health awareness and breast cancer awareness. Before we dive into these critical subjects, let me briefly summarize the mission and programs of AWPLI, as we'll use which stands for Access to Holistic and Productive Living. AWPLI is a nonprofit 501c3 organization deeply committed to making a real difference in the lives of vulnerable, underserved, and uninsured minority communities. We achieve this mission through several innovative programs that address various aspects of well-being. Let's take a closer look at these programs and how they tie into Mental Health Awareness Month. Let's start with Let's start with the Bright Beginnings program. This program, initiated in 2010, serves pregnant and postpartum women in Prince George's County, Maryland. Its mission is to improve birth outcomes and reduce infant mortality by providing comprehensive maternal care and support. Bright Beginnings contributes to the mental well-being of mothers, reducing stress and anxiety during pregnancy. Another program is Community Health Integrated Service System. That's commonly referred to as CHIS. CHIS serves individuals who are 18 years of age or older, living in Prince George's County and meeting specific criteria that includes low income, belonging to racial or ethnic minority groups, and having health conditions such as diabetes, asthma, or heart disease. Access to health care and chronic disease management through CHIS is essential for reducing the mental health burden caused by these conditions. Another program is Community HIV/STI Outreach Program. That's a mouthful, but we call it CHOP. Targeting Prince George's County residents aged 13 to 24, CHOP focuses on youth HIV, AIDS, and STI education and prevention. By providing education and access to sexual health resources, this program addresses the mental health concerns associated with sexual health and relationships among young adults. Community Health Worker Certification Training. This program recognizes the critical role of community health workers, CHWs, in promoting health and preventing diseases, especially in underserved communities. CHWs serve as trusted community members who can provide emotional support and guidance, reducing feelings of isolation and hopelessness that often accompany health challenges. The Promised Neighborhoods Drug-Free Coalition. Launched in 2014, this coalition brings together concerned community members and adolescents to combat drug, opioid, alcohol, and marijuana misuse in Prince George's County, Maryland. Substance misuse often leads to mental health diseases, and the coalition's efforts to prevent and address these problems are crucial for community well-being. The Mental Health Awareness Program, as we discussed earlier, aims to raise awareness about mental health, educate individuals and families in the community about prevention and intervention, and reduce the stigma associated with mental health illnesses. MHAT, as we sometimes call it, directly addresses mental health concerns by providing education and support. The Social Determinants of Health is another program. We call that SDOH. Our current program, Health Advocates Promoting Healthy Living, focuses on mitigating social determinants of health, improving healthy eating behaviors, and promoting physical activity among obese, overweight individuals and those interested in weight management residing in target communities. Addressing social determinants like food insecurity and lack of access to safe physical activity spaces is vital for improving the mental health being in these communities. Last but not least are our psychosocial services. Our psychosocial support group is led by trained facilitators who are knowledgeable about HIV and its impact on physical, emotional, and social well-being. They provide a supportive environment where members can openly discuss their feelings, concerns, and questions without fear of judgment, emphasize the confidentiality and trust. These support groups are integral for individuals dealing with the emotional toll of HIV and AIDS. Now, Let's delve deeper into the importance of Mental Health Awareness Month in Prince George's County, Maryland, and how AWPLI's programs can play a pivotal role in addressing mental health challenges.
Thank you, Ralph. My name is Janel Love, and I work with the Mental Health Awareness Program.
Hi, everyone. I'm Sarah Prince, and I'm a community health worker for CHOP, which stands for Community HIV and STI Outreach Program.
Thank you, sir. Mental health is a critical concern in Prince George's County. The statistics highlight the urgency of addressing the issue. According to recent data, approximately 30% of residents reported experiencing symptoms of depression or anxiety within the past year. This means nearly 1 in 3 individuals in our community have been impacted by mental health challenges.
Absolutely. And, I feel like these numbers are concerning, Janelle, and they underscore the need for proactive efforts to support mental well being. And so the Mental Health Awareness Month provides a unique opportunity for us to shed light on these issues and reduce the stigma surrounding mental health.
Exactly, Sarah. And one of AWPLI's programs, the Mental Health Awareness Program, or MHAT, is specifically designed to address these challenges. MHAT aims to raise awareness on mental health and provide essential education to individuals in our Prince George's County community.
That's true. And MHAT offers a range of workshops and training sessions that can equip individuals with the tools that they need to cope with those mental health challenges. So these workshops cover topics such as stress management, which we all need a little bit of, mindfulness techniques, and building resilience. So by providing information on prevention, intervention, and education, we empower our community to take control of their mental well-being.
Yes, Sarah, we all need some stress relief techniques, but let's not forget about reducing stigma because that is really associated with mental health. And that's why a lot of people tend not to get help. It is crucial for individuals to feel comfortable when seeking help and support. And MPAT actively works towards creating healthy, comfortable environments to allow people to get the mental health support they need with no judgment, of course.
Absolutely, Janelle. We have to get our minds right. And so MHAT's community outreach efforts are extensive. So they partner with community organizations in Prince George's County to host these mental health awareness events and destigmatize seeking help.
Exactly, Sarah. MHAT has a huge impact on our community, but it's also essential to realize that it's not just one piece of the puzzle. AWPLI offers so many other programs that address social determinants of health, promote healthy living, and also support for those dealing with HIV and AIDS.
Exactly. And as Rolf mentioned earlier, take the community health worker training program, for example. That program directly addresses social determinants of health by providing resources for healthy eating and physical activity. So, exercising and getting your exercise in. So, these lifestyle improvements can have a profound impact on mental health as well.
Yes, they absolutely can. But let's not forget about the Promise Neighborhoods Drug Free Coalition program. By working to prevent substance abuse, this program helps reduce the root cause of mental health challenges right here within our community.
And that community is diverse, and the challenges that people face are multifaceted. So, by offering a wide range of programs, AWPLI is taking a holistic approach to supporting mental well being in every segment of our community.
Yes, Sarah. Our holistic approach is what sets us apart from pretty much any other company. We have, Bright Beginnings, Chiz, Chops, Impact, and other programs that play a vital role in promoting overall health and well-being in our community, which is contributes a large part to mental health.
Exactly. That's so true. And it's important for everyone to know who's listening that there is help available. So if you or someone that you know is struggling with mental health challenges, we have an array of resources for you. And please reach out to us. We are available on Instagram, and we have our website as well linked.
Yes, Sarah. It's very important to let people know how to reach us, especially working with different populations. Social media is very important for us. And we want people to know that seeking help is a sign of strength and not a sign of weakness.
Exactly.
Working together with the help of programs like MHAT and all of our other programs that we offer, we can make a positive impact on improving the mental health well-being within our community.
And remember, mental health is a shared concern. So by supporting one another and promoting open conversations about it, we can create a more compassionate and resilient community.
Yes, Sarah, I really agree with that.
Yeah.
Our community has the strength to overcome mental health challenges, and together we will thrive.
Thank you, Janelle and Sarah, for sharing these detailed insights and highlighting the essential work AWPLI is doing to support mental health in Prince George's County. Together, we can break the stigma and promote mental well being for all. Now, we're honored to have two remarkable individuals with us today to discuss a critical topic during this Mental Health Awareness Month. Joining us is Delegate Diana Fennell, a breast cancer survivor, and Dr. Deneen Long-White, who will be conducting the interview.
Thank you, Ralph. And thank you all for joining us today. I'm Deneen Long-White, Associate Professor of Public Health at Salisbury University. And I'm joined today by Diana Fennell, Delegate Diana Fennell. I'm so very honored to have her here today to talk about her journey as a breast cancer survivor.
Thank you, Dr. Long-White. It's a privilege to share my journey and my insights with our community.
Okay. Well, before we dive into you sharing and inspiring us, I want to share with everyone just some statistics around breast cancer. Specifically, in Prince George's County, breast cancer remains the most common cancer among women, with 1 in 8 women being diagnosed in their lifetime. Additionally, and this is what really surprised me, our county has the highest breast cancer diagnosis rate in the nation. And so that was really surprising for me when I saw that.
Well, Dr. Long-White, you're absolutely right. The statistic underscores the importance of raising the awareness and moving support for providing support for our community. It's very important for us to do that, and the statistics are very high. You're absolutely right.
Well, Delegate Fennell, let's start with your experience. Can you share more about your breast cancer journey and the emotions that you went through when you were first diagnosed?
Dr. Long-White, it was actually when I received the diagnosis, it was a overwhelming and frightening experience. The fear that I had was dealing with uncertainty gripping me like no other. I thought about what this meant to my family, what it meant to my community. But with time, I found the strength to be able to confront, you know, this head on. It was not easy, but I found the strength. And thank you for asking me about that journey.
Yeah, it sounds like it was undoubtedly very challenging for you. Can you talk more to us about those emotions, the emotional aspect of your breast cancer journey, and what you found to be helpful as you went through that journey?
Well, one of the things, on Dr. Longwork, I leaned on the support of my family. First of all, my father, um, that we rely on, and also support of my family and my friends, and also the support of others in reference to Prince George's County Health Department, John Hopkins, who was a great help in medical staff, and it was just a lot of source of comfort and understanding that was given to me during that time.
It sounds like you had a lot of support, and that's really important to help one get through this journey of a breast cancer diagnosis and treatment and
Hmm.
recovery. Um, Can you tell us a little bit more or give us some advice about how we can, other things that we can do to help us through this journey and other kinds of resources that are out there that may help us?
Well, first of all, Dr. Long-White, if you suspect something, if you suspect something, please make sure that you go and you seek professional medical guidance immediately. You know, early detection is very crucial in reference to breast cancer. And what you want to do is you want to lean on the support of a network, whether it's family, friends, or support group, that can provide emotional and practical assistance in reference to the challenging journey, because it's not an easy journey. Because not only if you're dealing with the process of having breast cancer, but you're dealing with the mental issue of it too, because it was actually an out of body experience. So you want to make sure that you seek that support system also, not only in reference to dealing with the support system of dealing with your friends and your family and the breast, but also it's a mental thing too also.
Mhm. Absolutely. Delicate now, let's talk a little bit now about awareness and prevention. How can
Mhm.
individuals in Prince George's County become more aware of breast cancer risks, and what steps can they take to prevent it?
Well, you want to make sure that you raise awareness in reference to making sure, in reference to the educational component, in reference to making sure that you get yourself checked, and especially in this all first of all over, just not in Prince George County, the state of Maryland, but all over. You want to make sure that you constantly do those checks and make sure that you let everybody know that education is a key component in reference to making sure you get this checked out the long way.
That's very good advice, Delegate Fennell. I know one of the things that I encourage my friends to do every month is their monthly breast self examination. So thank you for playing that up and that importance of awareness. Tell us a little bit about the role that community initiatives may have in helping to raise awareness as well as educate individuals around breast cancer.
Well, one of the things you want to make sure that, and I'm going to talk basically in reference to me, you live in to a low to moderate area or underserved population, that is, making breast cancer awareness is accessible, like programs like the AWPLI, and I want to name them for a reason, because AWPLI is very helpful and also getting information about, um, talking to you in reference to mammogram and units and workshops and support groups. And then you also have the Prince George's County Health Department, you have the Maryland Health Department. And education is so important in reference to getting those resources, because not only if you get those resources, they also giving you education so they can teach you about early detection early, because if you have early detection early, it saves lives, and not only save lives, but it prevents breast cancer itself, in reference to prevention of breast cancer. So that's important.
Yeah, those are really invaluable insights, Delegate Fennell. And I thank you for that. It really does play up the importance of not just prevention awareness, but how we have these community pieces, networks within the community to help with that, those initiatives. Tell us a little bit about your role in some of the legislative things that have passed. I know you've played a really important role in that in the state of Maryland.
But thank you, Dr. Long-White. And I'm talking about my personal journey, how I played a role. Um, I was actually at a screening and imaging site, where I was able to see two ladies, one who was diagnosed with lung cancer, and the other one was breast cancer. And they couldn't afford to come back for the next screening and imaging. And I was like, this is impossible. So what happened is that's how I came up with the bill HB 815, in which House Bill 815, what it does is, matter of fact, let me say that this bill takes effect and it was passed July the 1st of this year, 2023. And what this bill does is that people who cannot pay their co-payment or either be able to pay for the screening and imaging of breast cancer or lung cancer, they do not have to pay. They pay little to none in reference to trying to get this done. If they do not have the money, they do not have to pay. And one of the things that was put on in this bill also is that we it helps with the early detection of screening and imaging by allowing to do so, but also an education component was put into this to also to educate the community, that even from the hospital to the nonprofits to the non-governmental agencies in reference to the screening and imaging, and making sure that you go ahead and get checked for early detection to be able to save lives.
Wow, that's just really remarkable, Delegate
Thank
Jeanette.
you.
It shows us your I hear your passion, your compassion in that as well. And we really do needed something like that bill here in the state of Maryland as well as in Prince George's County.
Mhm.
Can you tell us a little bit more about your vision for the future as it relates to um, Prince George's County and the state of Maryland for those who face breast cancer?
Well, one of the things is that you want to continue to make sure that we have the organizations, and I'm going to continue reference to AWPLI because I work with them very closely, to be able to get the word out in reference to, not only in reference to the bill that was passed, which is HB 815, in reference to that you pay little to none in reference to making sure that you get screening and imaging, and not only that, the educational component in reference to making sure that you do so and what it causes in effect, but also recommendation of resources and making sure that resources that we can eliminate in reference to eliminate people from dying when they don't have to die of this breast cancer and lung cancer because of early detection, in reference to making sure that we educate them. That's my vision, is to save as many lives as we can. That's my vision.
Well, I thank you so much, and it's a wonderful vision. I know that your tireless efforts will definitely make a difference for not just individuals in Prince George's County, but also in the state of Maryland. Thank you, Delegate.
Well, thank you, Dr. Long-White. And I do want to just add this. I'm here to make a difference, and that's the reason why we did. And I thank you for allowing me to join your podcast and to be able to talk about the awareness and the educational component of breast cancer and lung cancer. Thank you so much for having me.
Thank you.
All right. Thank you all for joining us today in this special podcast dedicated to Mental Health Awareness and Breast Cancer Awareness Month. We've heard powerful stories, valuable insights, and crucial information that can make a difference in our lives and our community. As we wrap up, remember that awareness and knowledge are the first steps towards positive change, whether it's addressing mental health challenges or taking proactive steps in the fight against breast cancer. Our community stands strong when we support one another. Let's continue these conversations, share the information we've learned today, and work together to create a healthier, more informed, and more supportive community. Thanks again to our incredible guests, Delegate Diana Fennell and Dr. Deneen Long-White, for their expertise and inspiring words. Stay tuned for more podcasts from Access to Holistic and Productive Living. We're here to empower and educate, and together we can make a difference. Until next time.